Hello, it's Tams at Dr. True and Dr. Rivera's office, True MD. I'm here with Lori again today, one of our wonderful nurses. We are here to talk about something that you don't have to be a real housewife to do, but a lot of them are doing it, and it is vaginal tightening without surgery. Why do we want to do this? Well, we want to have a little tightening without having any downtime. We want to have something done that's not invasive, and we want to have the latest and greatest done. And the Kardashians are doing this, and many other people. So I asked Lori to come in here to tell us about this so that she could kind of give you an idea of what to expect if you come in to do it. A lot of people are doing this, so don't be embarrassed to talk about it, and don't be embarrassed to listen about it. Lori, tell us what you've been doing with our patients lately on this.
Well, we've got several options for vaginal tightening. One of those is V-lace. And people like the V-lace because there is minimal downtime. What does that mean to you? You can return to sexual activity right after your procedure. Unlike some of the lasers that might have a freeze time of 4 to 6 weeks till you can do that again. So that's a big bonus. This doesn't require any anesthetic. It's a simple office visit, outpatient. The procedure takes about 15 to 30 minutes.
Wait. I want to ask you. No anesthetic, not even a Valium, nothing, right?
No, it's a pretty painless procedure. It's minimum pain. I've had this procedure done myself, and I know a lot of the girls in the office have it. It's a favorite, okay?
Yes.
It's very tolerable. You can get up and get off the table and go back to work and resume regular activities, which is a real plus.
Yes, it is. How long does the procedure take, and who does it? You do the procedure, right?
I administrate the procedure. The procedure takes about 15 minutes usually. It can be 15 to 30 minutes depending what your needs are.
Okay, and show them what they're going to be. Let's show them the machine and the program.
Do we want to tell them what it's for first?
Well, we talked a little bit about the vaginal tightening already, and for sexual stimulation.
And the urinary, because you know.
So there's 3 patients that might present with 3 different problems. One would be, of course, kind of a mommy makeover after pregnancy. Sometimes there'd be some laxity and things aren't as tight after a vaginal birth as they were. And so the CO2 laser can help tighten and make more tightness in the vagina without having to go through a surgery, because surgery is not always the best option, especially if you want to have more children.
Yes.
So it's real good for them. Another candidate would be your menopausal woman. As we get older, there's dryness, itching, pain with intercourse, and unfortunately, there's only one way. We have hormone therapy we can offer people, but sometimes that's not enough. So using a CO2 laser vaginally can help restore that, produce more collagen, brings more blood flow into the area, so then there's more lubrication, the canal thickens, and it actually can reverse aging.
And it also provides a better sexual experience for the woman, right?
Yeah, a lot of people use it for sexual enhancement, and many people can tell that their first night if they have intercourse, up to sometimes 2 weeks to feel that, and then it potentiates and it gets better even at 6 months post the laser as the tissue rejuvenates.
That's awesome. Okay, now let's show them the machine and show them what to expect.
So it sounds a little maybe overwhelming if you don't know what's involved. So this is the probe, and in here you can see the laser, the CO2 is going to hit this little mirror, and that's then going to bounce back then to the vaginal wall. Like I said, it's minimally invasive. It's non-ablative. That means there's no bleeding, there's no trauma to the skin. The laser heat's going to go into where the collagen is formed. And that's why it's such a minimal procedure and why you can still go back to normal activities the same day.
Okay. And this is one of our machines. This is the V-lace. We've got more than one machine. This is our newest machine. There's Thermiva, and then there's V-lace. And we really like this one. We wanted to feature this one today because it is the latest and greatest technique.
And both of those are FDA approved for vaginal tightening. Something else it helps with is people who have incontinence, stress urinary incontinence. As we get older, sometimes we're crossing our legs a little bit when we laugh,
jumping on that
trampoline out, and so the supports for the bladder and the urethra get lax. And so to tighten that, to help that, this laser will actually hit up where those supports are for your urethra, tighten those, and help with your stress urinary incontinence. In fact, a lot of this technology was first developed to help stress urinary incontinence patients. And then they realized it also does some vaginal tightening, and also because it's increasing that blood flow and collagen in that area, it makes sex feel better. So who wouldn't want that?
Oh, absolutely, absolutely.
Yep.
Okay, so they'll come in, and how many treatments do they need, Lori? 1, 2, what do they
So
need?
the typical treatment would be one laser session for 15 minutes a month for the first 3 months.
Okay.
And then to keep that collagen remodeling and going, a touch-up treatment every 6 months to keep what you've tightened up, tightening. So not bad.
Awesome. Okay. And the treatments are about $1,000 each. We're doing a special right now for Facebook listeners only, or viewers, I should say, only. You get each treatment for $850 if you purchase the package of 3 up front. So that works out to about $2,550. Now, that's about half the cost of an invasive surgery, or even less, depending on what you need done. You can't go wrong there, can you?
No, that's a good deal.
Okay.
And definitely worth the benefit
Yes,
for most of us ladies.
Yes, most women love this. It is for women only. I do want to stress that, but you'll be so happy you did it, especially if you're struggling. This is a difficult subject to talk about. We've talked about it more than one time. We've talked about the surgery. We've let Dr. True explain his viewpoints and some of the things that he does. But this is done in the privacy of our office with another woman, Lori, and you might get one of the other girls, Becca, but it is a procedure that is very private. No one's going to know what you're here for. You don't really even have to tell your partner. It's something that is no recovery, so why do you have to tell anybody? So I want you to call us and get a consultation today. The consultation is free of charge. We do that here in our office. You can go to our website at truemd.com, visit us there, fill out a consultation sheet, or you can call us at 817-399-8783. Make an appointment. We'll get you in. And actually, if we've got the time, we may be able to start your treatment that day. You could be having a better experience in less than 24 hours, really. So please give us a call. Come in and see Lori, myself, for consultations. See Dr. True, Dr. Rivera. They are the best. They really are. Board certified in gynecology and cosmetic surgery. That's the best thing that you could do for yourself right now. Give us a call. Like us on Facebook. I'm Tams with Dr. True and Dr. Rivera. It's Lori.
Thank you for watching.
There's Lori. We'll see you next time. Thanks again. Tune in tomorrow for a special treat with one of our Real Housewives of Dallas. We've got a little treat for you in store, so don't miss us tomorrow around 2 o'clock.
Yay.
Okay?